So today we are going to talk about the Echinococcus granulosus. The disease caused by the Echinococcus granulosus is hydatid cyst. So there are the egg cell calcification, and the rupture of those cysts can cause the anaphylaxis because there are foreign material in those cysts, and that can cause those type of material when they rupture, they liberate those materials and can cause the anaphylactic shock. The transmission occurs through the injection of eggs in the food contaminated with the dog feces, and we should know that the sheep are the intermediate host of this Echinococcus granulosus. The treatment we do is by the albendazole. So now let us discuss the life cycle of this Echinococcus granulosus. Let us assume that there is adult worm in the small intestine of the dog and other carnivores, and this adult worm, after mating, they liberate eggs and the eggs are discharged in the feces. The eggs are swallowed by the intermediate host while grazing the field. That means the intermediate host is the sheep, and they accidentally ingest while grazing in the field, because whenever the dog pass the feces, egg may be passed with them and it may be present in the grass, and while grazing the field the eggs may be swallowed. The human can acquire the infection by the contamination through the various food, by the direct contaminations of the food by the feces of the dog, or the um, contamination of the other vegetables and foods. So in the duodenum of the intermediate host, hexacanth embryo hatches out, and the hexacanth embryo penetrates the intestinal wall and enters the portal vein and to liver as the first filter. So 70% of the infection is located in the liver in the first filter. And some embryo may pass through the hepatic capillaries and enter the pulmonary circulation. So lung is the second filter. There are few embryos that pass the pulmonary circulation to enter the systemic circulation, and that they may lodge into the various organs like brain, heart, kidney, spleen, genital organs, muscle, bone, and eyes. So wherever embryo settles, it may develop into the hydatid cyst. So from the inner side of the cyst, the brood capsule with the number of scoliosis develop. So you have to know that a hydatid cyst developing from the single egg, that we know as the mucosphere, may contain thousands of scoliosis. So these fertile hydatids penetrate in the viscera of the intermediate host, and when ingested by a dog, they develop into the adult worm in the intestine, and that cycle is repeated in the dogs, and if ingested by the man, that could be the dead end, until and unless there is the that cannibalism, and the natural cycle is maintained by the sheep and dog. So again, the adult worm is in small intestine, the egg are passed, and again they are ingested in the duodenum. The hexacanth embryo hatch, it penetrates intestinal wall, and again the whole life cycle occurs. So this much for today for the Echinococcus granulosus. I hope you understood this topic. Thank you.